Hello, my name is Raya Isa. I'm applying to the Family Nurse Practitioner program at San Jose State University for the fall 2024 semester. I began my career in Pittsburgh, Pennsylvania on a brand new surgical unit in the Western Pennsylvania Hospital, which is a part of the Allegheny Health Network. This unit was very lively. We had 15 to 20 post-op admissions as well as discharges every shift. So I got to care for patients getting all types of surgeries, and I got a great understanding of all the different body systems in that first 7 years. There were so many different surgeons. They all had different protocols. There were different care plans and discharge requirements for every different type of patient, which all required a lot of coordination with the interdisciplinary teams within the hospital, as well as the advanced practice providers, the nurse practitioners and the physician's assistants that worked with the doctors. And of course, I mainly communicated with them when caring for their patients, the nurse practitioners and the physician's assistants. My second job was in an emergency department at UPMC Magee Hospital. This was also in Pittsburgh, Pennsylvania, and this hospital used to be a women's hospital. So most of the emergencies that we saw coming in were obstetric and gynecology related emergencies, although we did see regular medical emergencies daily as well. In this position, my interest in reproductive health really further ingrained within me an understanding about access to healthcare. I saw firsthand how for many marginalized communities, the emergency department is really the first and the last line of healthcare. And I also unfortunately saw firsthand the racism and sexism towards these especially vulnerable patients. Most of the providers there were nurse practitioners or physician's assistants. We usually only had one physician supervising on each shift. So I worked directly with many nurse practitioners and got to see the amount of autonomy they had on their patient's care plan from admission to discharge. Lab work, medication, testing, performing procedures, and developing their plan of care. This was all up to the nurse practitioner. This really instilled in me the drive to never stop learning about new healthcare information, best practices, how they're changing and developing. The nurse practitioners in the emergency department were so independent and they needed to provide safe care quickly in a fast-paced setting. In 2019, I accepted a position as a director of nursing at an independent reproductive health clinic in Pittsburgh. Caring for these patients that were seeking abortion care, OB care, gyne, and trans care led me to develop my personal dedication to providing person-centered and trauma-informed care, especially to these vulnerable and marginalized patients. When I moved to Oakland, California, I worked at Planned Parenthood in San Jose, in Oakland, and San Mateo. We cared for patients during their abortion care, and we also had, as registered nurses, our own independent schedules for office visits. So I had my own NPI number, I prescribed birth control, emergency contraception, performed lab work and testing, and of course counseled many patients through different situations involving reproductive health. I also really got to know the difference in access and legislation regarding reproductive health care, and that really only increased my passion for reproductive justice, and it really gave me a closer look at what I can do as an independent provider, as a nurse practitioner. Now that I'm back on mostly a surgical inpatient unit in the hospital, I have much less autonomy and influence on my direct patient care, and I'm very eager to advance my practice to the next level, to be a more independent provider. I want to be a bridge between my patients and our healthcare system, and I want them to truly be able to rely on me to provide them with safe care and also to educate them in being involved in that care, being that bridge between being a healthcare provider and being a patient advocate, as nurses are. Thank you so much for taking the time to consider my application, and I look forward to hearing from the program.